This video will explain what will happen if someone gets sick with COVID-19 in the Nhulunbuy district region, which you will call the Miwach region. The Northern Territory government, working with the land councils, the Aboriginal Medical Services Associated of the NT and local organisations, has made a plan about how to protect Yolngu and Balanda if someone brings coronavirus to the Miwach region. This video will explain this plan, which is called the Nhulunbuy District Local Pandemic Plan. This plan is for everyone staying in Nhulunbuy, Yirrkala, Kunyangara, Pirikimi, or nearby homelands. These homelands include Paniala, Pararaitpi, Barkira, Pawaka, Breng, Pukudal, Puimar, Talinbuy, Tanaya, Tulchi, Jarakpi, Kalupa, Kartalala, Kikkal, Kurkawoy, Kuromuro, Kuchangan, Malarami, Matamata, Muttamul, Roroy, Rurangala, Wandawoy, Yangunbi, Ninikay, Ga, Yudoyudo. What will the sick person do? If doctors find someone sick in Nhulunbuy Township or in Yirrkala or in Kunyangara or in any of the homelands, the first thing that will happen is the sick person will be taken to Gulf District Hospital. Then they will be taken to Royal Darwin Hospital. This is to stop them spreading the virus to more people and so that they can get taken care of by doctors. What will happen to the people the sick person has been near? Then health staff will start contact tracing. This means they will try to find all the people the sick person usually stays with and any other people they have been close to in the past few days. Health workers call people who have been close to a person sick with coronavirus, close contacts. All of these close contacts will be taken to Nhulunbuy to stay together somewhere for a few hours, like the Nhulunbuy Town Hall or somewhere else. Then they will be taken to the quarantine centre in Howard Springs near Darwin or to hospital if they are sick. These people might have received coronavirus from the first sick person, so we need to take them away from the community quickly so that they don't infect anyone else. They will stay in Howard Springs for at least 2 weeks and workers will bring them food, medication and whatever else they need. If they get sick while they are there, they will also get taken to hospital. What will happen to everyone else? As soon as health workers know someone in the region is sick with coronavirus, some people will be told to stay at home. There are 2 different staying at home pathways that will be followed for people in the Nhulunbuy district region. One pathway is called lockdown and the other is called community quarantine. When people are in lockdown, they will stay at home most of the time. They will only leave their house once or twice per day. When people are in community quarantine, they will stay at home all the time, all day and night. People in Nhulunbuy will only ever follow the lockdown pathway. People in Yirrkala, Kunyangara or homelands in the Nhulunbuy district region might follow a lockdown pathway or community quarantine pathway at different times. Now we will tell you more about the lockdown and community quarantine pathways. Community quarantine. If someone in Yirrkala or Kunyangara gets a test to find out if they have COVID-19, and the test says yes, they do have COVID sickness, everyone living in that place will go into community quarantine. For example, if a sick person is in Kunyangara everyone who normally lives in Gunyangara will be told to stay inside their homes for 2 weeks or longer. Gunyangara residents will stay inside their homes all day and night. You can sit outside in your yard, but you can't go outside of it. This means you can't visit family, go to the shop, drive to another community or homeland, and so on. This is a very difficult pathway, but it is the strongest pathway to stop many people from getting very sick or dying. The police, army, and many health workers will come to the community and work with Yolngu organizations to help everyone through this difficult time. Food, drink, medicine, and other things like cigarettes will be brought to houses. Health staff with Yolngu workers will test everyone for coronavirus. Workers will plan how to help sick and older people to stay safe. At the same time, everyone else in Nhulunbuy district region, people in Yirrkala, Nhulunbuy, and homelands, might also be told to go into lockdown. This is to keep everyone in those places safe and to give workers time to find all the people who might be sick with the virus. If a person with coronavirus is found in the homeland, first, that homeland will go into lockdown for 3 days. After 3 days, 2 pathways could happen. The government might tell that homeland to stay in community quarantine. But this might be too hard to do at some homelands, like if it is quite far from a community. Everyone in that homeland will be taken by a plane to stay at the Hot Springs Quarantine Center. During this time, everyone else in this Nhulunbuy district region will go into lockdown. For more information about community quarantine, watch this video in Yolngu Mata. Visit vimeo.com/516531547. Lockdown. If someone in Nhulunbuy gets a test to find out if they have COVID-19 and the test says yes, that person has that COVID-19 sickness. Everyone in Nhulunbuy as well as everyone in Yirrkala, Gunyangara, and all the homelands will go into lockdown. Lockdown means everyone will stay at home for most of the day and night. People can only leave their house for the reasons given by the chief health officer. For example, to get food or medicine, to do essential work, to exercise, or to take care of someone who needs help. If there is a lockdown, there will be information shared about the lockdown rules on Facebook and Yolngu Radio. Lockdown will go for 3 days and maybe longer. In the first 3 days of lockdown, health workers will be trying to find anyone who has been recently living with that person who has the COVID-19 sickness, and anyone who has been sitting or standing close to that person in the last few days. Because there are so many houses in Nhulunbuy, it would be too hard for police and health workers to help everyone in Nhulunbuy if they have to stay inside all day and night. The other reason that Nhulunbuy will follow a lockdown pathway, not a community quarantine pathway, is that if Nhulunbuy is in lockdown, important services like the Woolworths or hospital will still be open. So people in Yirrkala, Gunyangara, and homelands will still be allowed to travel to Nhulunbuy if they need to go shopping or go to the hospital. They won't be allowed to travel to Nhulunbuy if they are in a community quarantine though. These lockdown and community quarantine pathways are 2 of the best tools we have to protect everyone and stop the virus from spreading all over Arnhem Land. But they only work if everyone follows the rules about staying at home. If you leave your home or community, you might make your family very sick. Get prepared for lockdown or community quarantine. We all hope this coronavirus doesn't come to Arnhem Land, but we have to prepare for it. There are things we can do to prepare now. If we all do them starting now, we will save more lives if people get sick and we have to stay at home. Get a COVID vaccine. COVID-19 vaccines are good at protecting people from getting sick with COVID-19. Now is a good time to go to your clinic to get the vaccine. For more information about the vaccine in Nhulunbuy, listen to Nhulunbuy Radio or go to vimeo.com/563113467. Social distancing. We all need to start following that physical distancing and hand washing pathway again. If we do this, when the virus comes, it will stop some people from getting sick. Wash your hands with soap often, a few times a day. Stand 1.5 meters away from people, unless you live with them. Don't give handshakes or give hugs. Buy food and supplies. If your community, homeland or Nhulunbuy township goes into lockdown, you are still allowed to go to the shops once or twice a day. But you will be safer not going to the shops too much, because there will be lots of people there and you might get sick. It is a good idea to think about buying some things to help you stay at home for a few days without going to the shops. For more information about coronavirus, listen to Nhulunbuy Radio 88.9 FM or visit coronavirus.nt.gov